How is avian chlamydiosis diagnosed in birds? Have you ever wondered how veterinarians figure out if a bird has avian chlamydiosis? This bacterial infection, caused by Chlamydia psittaci, can be tricky to diagnose. There is no single test that can give a clear answer. Instead, a mix of clinical evaluation and laboratory tests is used to confirm the presence of the bacteria or the bird's immune response to it. First, veterinarians start with a physical examination. They look for clinical signs that may indicate an infection. Birds that are acutely infected often show symptoms like respiratory distress, lethargy, and unusual blood test results. For example, an elevated white blood cell count can suggest an infection is present. Additionally, liver enzyme levels may be higher, indicating that the liver is affected. Next, laboratory tests come into play. There are three main types of tests used to diagnose avian chlamydiosis. The first is the Polymerase Chain reaction assay. This test detects the genetic material, or DNA, of Chlamydia psittaci in various samples. These samples can include blood, swabs from the eyes, throat, or cloaca, and even feces. The Polymerase Chain reaction test is sensitive and can identify the bacteria even if the bird is not showing symptoms. However, a positive result only indicates exposure, not necessarily an active infection. This is why it is important to consider clinical signs alongside the test results. The second type of test is serological testing. This involves measuring the antibodies in the bird's blood that are produced in response to the infection. A single antibody test can be hard to interpret because it may reflect past exposure rather than a current infection. To get a clearer picture, veterinarians often take paired blood samples weeks apart. They look for a fourfold or greater increase in antibody levels, which confirms an active infection. The third method is culture, where the bacteria are grown from samples. However, this method can be complex and time-consuming, so it is less commonly used. Since birds can carry the bacteria without showing any signs, it is often helpful to take multiple samples over several days. This increases the chances of detecting the bacteria. Combining serology with the polymerase chain reaction test or culture can boost diagnostic confidence. In cases where birds have died, a necropsy or animal autopsy can reveal typical lesions associated with chlamydiosis. This can further support the diagnosis. To sum it up, diagnosing avian chlamydiosis requires a combination of clinical observations and laboratory tests like the polymerase chain reaction assay, serology, and sometimes culture. This approach helps confirm the infection and guides treatment, ensuring the health of both individual birds and their flocks.